Hey everybody, Dr. Kramer here at Kramer Chiropractic, Livonia Spine and Injury. Today I got some special guests, Dr. Paul and Sherry. So I'm going to show what I call some couples assist, things that your couple can help you reduce your pain, improve your mobility. All right? So the first thing we're going to start with is working on these muscles here that everybody is tight with. If your head's out of alignment, if you had a whiplash, if your work requires you to look down like you're a computer, or you're a surgeon, your head's bent down all day long, these muscles get chronically shortened. So here's a simple trigger point you can do. So I'll demonstrate it, then my assistant Sherry, the expert, she'll come in. So we've shown you in the past where we tack and stretch and how to do it, and that's great when you're by yourself. But can it be done better if you got someone to help you? Of course it can. So what we're going to do is this. So we stand up on somewhere safe, guys. Paul, I want you to shorten your neck. I'm going to take two thumbs so I don't hurt my thumbs, and I'm going to put some pressure, and then take your other hand, Paul, and stretch. So he's going to do just a 6-way neck stretch. He's going to breathe. Now he's going to, good. Now turn your nose into the right. Very good. Hold it for 5 or 6 seconds. Relax. You go in slow and you come out slow when you do these trigger points. All right, Sherry, be nice to your husband. All right.
No promise.
So we break this muscle up in probably 3 areas. So we'll start out close to the shoulder, and then halfway, and then close to the neck. All right, so go in slow. Paul, you're going to go straight to the right. So what we're doing, he's going to stretch his head to the right. Far as you can, that's comfortable. Not forcing it. Breathe a couple breaths. You got to learn to really let it go. Breathe out. Good. You do a couple breaths. 2, 3, 5. Hey, if you're tighter one day, do 5. If you feel you're pretty loose, just do 2. And then we're going to turn our head, nose to the pocket. And now we're going to hit it a little bit differently. All right? Couple breaths. 2, 3, 4. All right, Sherry, gently come out. Were your thumbs okay?
Yes.
Not too bad. Watch your step. All right, now we're going to go a little bit closer. Midway now. Okay, our thumbs are like this. Go in slow. He shortens the muscle. And then we gently just stretch. Breathe. A few breaths. Keep your thumbs like this. I don't want you to hurt your thumbs. She has beautiful thumbs. I don't want to ruin those things. Paul will yell at me. Then, after a few breaths, bend your head down. Turn to the right. All right, so we do this way first, then down into our pocket. And we stay there for a couple breaths, 2 to 5. And it depends. On the days you're stiffer, you do more. Okay, relax. Now we're going to get close to the neck, like close to here. Okay? Oh, all right. Does that feel okay to you, Paul?
Yeah.
All right, go ahead and stretch. And breathe. Great. Good. And you can also go ahead and come out slowly. Watch. I'm going to have you step down. My lovely assistant, Sherry. You can also work in this area too. All right? So you can do both sides of your neck. Now what we're going to do is work on our scapula. So Paul, I'm going to have you face this way. And we talked about this in the past primarily for shoulder, but this also plays a role with neck and upper back. So shoulder problems, shoulder stiffness, shoulder pain, upper back pain, neck pain, many times in addition to the segments being stuck or misaligned, what we call subluxation, in addition to groups of vertebrae being out of alignment like bad posture, sometimes the ribs just don't move well. In this scapula, go ahead, put your hand behind your back. This triangular bone gets frozen. So almost all shoulder issues, this is a culprit. So we're trying to get this scapula, this wing bone, to move relative to the ribs. So go ahead and take that out. So what we do is we take the lacrosse ball, we lie on our back, and we're going to place it between the scapula and the spine. And then we're going to bring this arm up 5 or 10 times. And then Paul's going to side bend his head a few times too. Now just move your head back and forth, to the right and left. All right? And then we're going to move the ball to here and do the same thing. All right, so we told you, now we're going to show you. Okay, go ahead, lie back. Bend your knees, Paul. Always bend your knees. Pull your shoulders back. Now, if Paul forgets to do the dishes or doesn't vacuum or talks back to his wife, His wife is going to give him some extra love and stretch his shoulders back. That's a little bit painful. It's healthy, but it's painful. So you decide how hard you want to work. So Paul, go ahead and bring this arm, keep the elbow straight, and bring it back far as you can. That's comfortable. Okay, and then that's it. And he goes, do what you can to what's comfortable. Over time, this will go back. As his shoulders get more flexible, his ribs get, and breathe. Always breathe. Good. And now we can go out to the side. Far as you can, that's comfortable. He also can come up around here. Now, that's part of it. Now, go ahead, turn your head right and left. Do what you can, that's comfortable. All right, now we move the lacrosse ball. So you can slide down a little bit or slide up. You find another spot. Unfortunately, the areas that really are uncomfortable are the stiffest, the ones we need to work on. Sorry, folks. All right, and you're going to do the same thing. You do about 5 or 10 reps. Bring your arm back. Now, could you do this standing up against a wall? Yes and no. Yes, but not in my house, on my walls. My wife would shoot you. So not against your drywall. That would ruin it. But could you have a door frame? Could you do it in the molding, that's the wood molding? Yes, you could. It's not going to ruin your door. So same concept, arms around. Spend a little bit more time. Paul, turn your head right and left. Go as far as you can that doesn't hurt you. This is restoring lost function. Okay, old injuries that have healed wrong. All right, now you're going to slide down a little bit more. All right, now we're hitting different spots. Go ahead, pull your shoulders back if you can. Now, over time, this will get easier, okay? Elbow straight. Again, if this is too painful, use a tennis ball. Put a towel over the lacrosse ball. Everybody's different. You know, strong strength athletes are going to get super aggressive. But if you're very thin, I've got like 19-year-old women that have scoliosis that are really thin, have to use a tennis ball to get this type of mobility done. So everybody's different. Work within your tolerance. You okay with that? Mm-hmm. All right, same concept. Turn your head right and left. And then try side bending your head. Just try to bring in your ear to your shoulder. Okay, come on up. Still breathing, Paul?
Still breathing.
Still breathing, Dr. Paul. All right, folks, so I showed you a couple tips. The most common area that your spouse can help you with, working on trigger points on the trap. Paul, wave to that. I want to make sure everyone knows that you're still alive here.
Notice I'm waving with my right hand.
Yeah.
The left.
Very simple, folks. Bottom line, every week we have a few tips out there to help you reduce pain, improve your mobility, and ultimately help you live stronger longer. Do me a favor, if you like this, just click it and share it. I'm sure you got a friend out there that's got neck problems and shoulder problems, upper back problems. If you're on YouTube, you know what to do. Just click the subscribe. We're always updating our channel, giving you information. And those of you out there that would like some help, hey, give me a call. If I can help you, I'll tell you. If I can't, I'll tell you that too. I'm Dr. Kramer. Everything we do here is to help you live stronger longer. I'll see you on the next video. Paul and Sherry, thank you. Thank you very much. You guys are a great sport. See you guys.
Thank you.